So my name is Dr. Chloe Sakal. I am a mental health doctor and I work in Bristol. Big shout out to everyone from Bristol. I saw there were quite a few of you in the chat there. So I currently work with the NHS Substance Misuse Services, but I've also done some research in the psychedelic and the cannabis field as well. I've actually got a PowerPoint. I'm a bit embarrassed I made a PowerPoint, but I'm going to share it and I'm going to do some slides. So here we go. Hopefully everyone can see that. Shout out if you can't. So this is my journey to where I am at the moment. So some of this might be a little bit medical student specific, but I've got some other experiences at the end that will apply to people who aren't in medical school as well. But I did science A-levels, then I went to medical school, which was a long old slog, 5 years. While I was at medical school, I integrated and did a neuroscience BSc as well. Once I graduated from medical student and I became a doctor, I did 2 years hospital medicine as a foundation doctor. I then went on to specialize in psychiatry, which was a 3-year core training. And I'm now, I have my membership with the Royal College of Psychiatrists, and I'm currently working in the substance misuse services in Bristol. So a little bit about what I do on a day-to-day basis. So this is what my week looks like. On Mondays, I run a inpatient detox ward. So I admit patients for 2-week detoxes from opiates and alcohol, and that's all kind of medically assisted. So I prescribe medication for them and just check that everything's going okay and that they're all right. And we have a great nursing team who look after them the rest of the week. On Tuesdays, I do teaching. So I teach medical students and other doctors, and I also do some research, which I'll speak a little bit more about in a minute. On Wednesdays, I supervise my nursing colleagues, and then I assess patients to do community alcohol detoxes. So in Bristol, we have a community detox service where patients come in and I prescribe medication to help them come off alcohol. On Thursdays, it's just a team meeting day. So we discuss referrals into the service, and then MDT stands for multidisciplinary team meeting. And I sit with the rest of my team and we discuss any problems or any issues that have come up. On Fridays, I don't work because I live the part-time dream for no other reason other than I just like working part-time. So that's quite nice. I occasionally do on calls as well, which I'm sure most people know doctors have to be on call, but that's once every 2 weeks. And that means people can contact me out of hours if there are any serious issues that need to be attended to, but often they're quite quiet. So that's my week. Once again, this is quite doctor specific. I'll talk about other general opportunities in a minute. But as a psychiatrist, we get lots of opportunities to look at other things, things we're interested in, and to do research. So we also have the opportunity to take time out from our NHS work where they hold our NHS contract open. So this is called an out of placement experience. This is something I did last year. So I took a year out of my NHS contract to work with drug science. And I worked on something called Project 2021, which was a medical cannabis registry. And this was a really fascinating project. In fact, we're about to publish the first set of data next week. But we essentially pulled the data from private medical cannabis clinics, looking at lots of different outcomes for patients, things like mood, quality of life, anxiety, sleep, to see how they were doing with a medical cannabis prescription. And we're about to publish that next week, if anyone's interested. So please do look out for that. I could have taken longer out if I wanted to. So psychiatrists can take up to 3 years out of their NHS contracts to do PhDs and things like that. But I decided to return to the NHS after a year. So I also get something called special interest sessions. So this is 1 or 2 days a week where you can choose to do anything really. And this is funded by the NHS and it has to be vaguely medically related. So some of the things I've done in the past is I've participated and helped out in research looking at MDMA assisted psychotherapy for the treatment of alcoholism. This is something we published, I think, a few months ago now. So the study's finished, but we were giving participants MDMA and then we were detoxing people from alcohol, giving them MDMA assisted therapy, and then following them up to see if they'd relapsed. And the results were really quite good. The relapse rates were much lower than our sort of comparative group. I've also currently taking part in a psilocybin for depression study that's going on in Bristol, although unfortunately it's on hold at the moment because of COVID, because COVID has ruined a lot of things for everyone, unfortunately. But that should be starting up again soon. So some of the other things I have also taken part in, I've done some of this in my spare time, but also some of this in my NHS special interest time. I currently work with the Loop, and they are a drug testing service in the UK. And I'm part of the senior management team at the Loop. And what we do is we provide drug testing services at festivals, events, and city centres. So when people go to festivals in the UK, they can actually bring us their drugs, and we will test the drugs in real time using infrared spectrometry. And then we can tell the person exactly what's in the drug and provide them with harm reduction advice about how dangerous it is to take the substance, and if they are going to take it, how they can do that in a safe way. And we've also done that in Bristol City Centre a few times as well. We're hoping that these are going to start up. This is going to start up again soon. Unfortunately, because a lot of the big festivals have been cancelled again this summer. I think we're hoping to do Parklife and Kendal Calling. I think those two are still looking like they might go ahead, fingers crossed. But we're also planning to start it up again in Bristol City Centre, so people can just come down with their drugs. It takes about 20 minutes to test the drugs, and then we can tell people what's in it. So that's quite cool. The website's there. They are always looking for volunteers, especially if you have a healthcare or a chemistry background. So please do go to the website if you're interested in doing it. This has been something that's really quite close to my heart, just because I think it's really innovative. It's the first service that's done this in the UK to be able to provide people with real-time results about what is in their drugs. But also because it's really fun. I really like working at festivals. It's a really great environment to work with. Obviously, you get free entry to the festival as well, and you can go and enjoy the music after your shift's done, which is it's just really fun. Another organisation that I have been involved in the past, I'm not working with them at the moment, but this is an organisation called Psycare UK. We're an organisation of they're an organisation of volunteers that provide psychedelic first aid at festivals. I think this is similar to what they have in the US, which is the Zendo Project. I'm sure some of my colleagues could correct me on that, but I think it's called the Zendo Project. But they essentially provide a safe space for people experiencing difficult trips at festivals. And once again, I really enjoy doing this work because I'm a big festival goer, and it's just really fun to work with a team in a way that reduces harm without stigmatizing drug use. So we essentially just let people come in and be looked after if they're having a difficult trip. And we work very closely with the medical team as well. So if things do become physically dangerous, we can take them to the medics, and the medics will look after them or potentially take them to hospital. And as a psychiatrist, one of my aims working with Psycare UK in the past has been to avoid people getting sectioned. So something I do as a psychiatrist is I do have the ability to section people. So that's when people who are suffering with mental illnesses get detained under the Mental Health Act for their own protection or the protection of others as well. And in the past, people have been sectioned whilst they're tripping on drugs, which shouldn't really happen. But often it's difficult for professionals to know whether somebody is suffering with a mental illness, namely psychosis, or whether they are under the influence of drugs, and people can end up sectioned under the Mental Health Act. So this organisation can help to avoid that happening by taking people and keeping them safe at festivals so they don't get taken into hospital and sectioned. There's lots of different roles that you can volunteer for with Psycare. So I've put the website up again, but they don't just look for people with healthcare experience. They look for lots of things like if you've got experience with social media or writing articles. They're a great organisation. So if anyone's interested, please do volunteer. So that's probably me. That's quite a brief run through of all the things that I've done.